What causes MALT lymphoma of the stomach? MALT lymphoma of the stomach is a type of cancer that primarily arises from a chronic infection with a bacterium known as Helicobacter pylori. This bacterium is quite common and often lives in the stomach lining. When it causes an infection, it leads to long-term inflammation, which can trigger the development of MALT lymphoma. The immune system responds to this infection, and over time, the lymphoid tissue in the stomach lining can grow abnormally, leading to lymphoma. The role of Helicobacter pylori infection is significant. When left untreated, this infection can cause chronic gastritis, which is inflammation of the stomach lining. This inflammation promotes the formation of mucosa-associated lymphoid tissue, or MALT, and can lead to the malignant transformation of lymphocytes, which are a type of white blood cell involved in immune responses. Chronic inflammation is a key factor in the development of MALT lymphoma. It usually arises in areas of the body that have been inflamed for a long time, often due to infections or autoimmune conditions. In the stomach, the primary cause of this inflammation is indeed the Helicobacter pylori infection. Genetic factors can also play a role in increasing the risk of developing gastric MALT lymphoma. Certain genetic predispositions, such as specific human leukocyte antigen types and mutations in immune-related genes, can affect how the immune system reacts to infections and inflammation. Other risk factors, although less common, can contribute to the development of MALT lymphoma. For instance, infections like the hepatitis C virus, immune system disorders, and conditions that suppress the immune system, such as HIV, can increase the risk. Age is another factor, as most cases are diagnosed in individuals over the age of 60. Emerging research suggests that environmental and lifestyle factors may also influence the risk of MALT lymphoma. Factors like obesity, metabolic syndrome, and high dietary salt intake may increase the likelihood of Helicobacter pylori infection, thereby indirectly contributing to the risk of developing gastric MALT lymphoma. In summary, the primary cause of stomach MALT lymphoma is a chronic infection with Helicobacter pylori, leading to prolonged inflammation and abnormal growth of lymphocytes in the stomach lining. While genetic susceptibility and other factors can influence this risk, the connection to Helicobacter pylori remains the most well-established cause. Treatment often focuses on eradicating this bacterium to reduce inflammation and slow down the progression of lymphoma. If you have concerns about stomach health or risk factors for lymphoma, it is always best to consult with a healthcare professional for personalized advice.